I'd say next we can do curcumin. Much better off to take it liposomally. That's very important. So liposomal curcumin. Also, make sure you cut out nightshades. Nightshades, and of course, grains and refined sugar can create joint issues. So you'd be surprised how many people that have chronic issues, just making those changes help. So liposomal curcumin for better absorption.
Why the
And I know you
nightshades? Will you riff on that for a minute? Because
the
nightshades are something.
solanines, the alpha solanines, they're compounds, they're anti-nutrients in the nightshade family. Tomatoes, potatoes, eggplants, peppers. These alpha solanines can get into the joints and they can kind of create a lot of inflammation. Similarly, with people that have oxalate problems, oxalates can get into the joints, these oxalate crystals, and create a lot of pain issues in the joint tissues, in the muscle belly too. Now, again, I don't go into oxalate restriction out of the gate because there's a lot of healthy foods that have oxalates in them, spinach and green vegetables. So if someone's coming off of a processed food diet, the last thing I want them to do is now be worried about oxalates because that restricts a lot of vegetables. So I don't worry about oxalates out of the gate if someone's diet's crappy. So
Well,
I would work on getting their diet really clean, and then potentially in some organic acid tests that we do, we could see if oxalates are really high. If do they have a history of kidney stone problems? Those kind of things are helpful.
and don't forget to mention too, candida. I mean, we'll see oxalates driven
Candida,
up tons
bingo,
from a
fungus
yeast
issues.
problem.
Yep.
So I've seen people on like a low oxalate diet for years. They still show up off the charts and they're having these joint pain
Yep.
issues. We simply just fix the yeast overgrowth or the fungal problems, and then the oxalate markers go down and their joints are better. So make sure that when you're doing a workup on these type of issues, whether it's mobility or pain or otherwise, make sure you're looking for these fungal colonization markers. You're looking at candida, you're looking at some of the bacterial overgrowth, because all
Yep.
these things are going to act as, we'll just say, a toxin in the bucket. And if you get this infection plus that infection plus yeast, then you really have a much, much higher chance of having these problems. And you go take the ibuprofen, you're not knocking any of that stuff out. The yeast is still there.
110%. So the oxalates may be more of a yeast issue, not necessarily an oxalate problem. So something we add to our list. We can also use things like boswellia or frankincense. Very, very helpful. Very good. Again, these things, how they're working is they're primarily modulating interleukins. They're primarily working on cytokines, reducing some of these inflammatory compounds. They may be working on the COX enzyme, COX2. They may be working on nuclear factor kappa beta, right? These are different inflammatory signals or chemical messengers. Maybe working on prostaglandin E2. So they may be helping a lot of these things. So we have to make sure if we use supplements, though, we're not just covering it up like a Band-Aid. We're actually trying to get to the root cause. So again, herbs tend to be better than like an ibuprofen long-term because these things kill tens of thousands of people a year taken the right way, right? Go look at Wolf et al., 1998, New England Journal of Medicine. Ibuprofen kills 19,000 people a year taken correctly. So using these medications like ibuprofens or NSAIDs in the short term may be fine. It's the long-term use because you're not getting to the root underlying issue. The nice thing is if you use the herbs and the natural things, long-term is virtually no negative impacts using those. But again, we're still not getting to the root. So use the herbs and the natural stuff long-term, try to get to the root, get to the diet things. That's your best kind of foundational thing.